Good afternoon, everybody, and welcome back to Richard White Global. I'm your host, Richard White, and as always, this is the channel where political correctness goes to die and the facts live on. Today, I want to do a special episode for my brothers and sisters in the Ohio Police and Fire Pension System that are retired or soon to be retired, and hopefully we'll pass this on to people that are coming down that road sooner than later. There's such a big transition into the retirement world once you get that pension started or once you turn in that notice to your employer. There's so many misconceptions, so much firehouse gossip, so much police station, I'm sure, rumor as well. Whatever it is, I'm here to clear up a lot of the facts and clear out a lot of those myths and rumors that just get passed around, like I said, to make this a much easier, smoother transition and what to expect. All right, here we go. So you've turned in your 2 weeks notice to your employer. They will turn around and notify the pension system of your last date that you're walking out the door to enjoy that sunny retirement in Florida or wherever it is you want to go, travel the world, whatever it is that retirees want to do, or just stay home and enjoy those grandkids. So, like I said, what now? All the rumors you heard, what are they real? What are they not real? Which ones are right? The unions do a pretty good job of moving you towards transition into retirement, but there's a lot of things that are left out, which that's not just their job. That's our job as the retiree to learn these things ourselves. So here we go. All right. You've turned in your notice, like I said. Your employer's now notified the pension system of your retirement date. So just because that's the date you turned in your notice, that is not the date the pension system's going to use. Here's how this works. We'll just use mine, for example. I retired on the date of May 4th. But when I turned in my paperwork, that's what it was dated. That's what it was dated at the pension system. My effective retirement date was actually May 28th. That's an important date we'll talk about later. So not the date that you walk out the door. That's just when you left your employer and stopped your earnings and wages with them and your time there stopped. All right, we'll get back to the effective date later. So once you've got that and they've notified the pension system of your last date of employment, you will soon, within a couple of 3 weeks, you'll get a notification from the pension system telling you of your effective date. Again, that's an important date we'll discuss later. That is not the date you actually walked out the door. So that's the first step. You've got your effective date now. So what you do with that? What's the difference? Well, the difference is that's going to be the timeline that sets in motion your annual cost of living adjustments, better known as COLA. That will also figure into the time figured in the pension system as well. So with that being said, let's move on. So they've notified you. You've now got your effective date. So now what? Okay, when do I get my first pension check? That's what everybody wants to know. And no, it is not right away. It doesn't matter if you were in the drop, if you did any of the drop. Once you're in the drop, it is based on that effective date. That is going to be the same date that if you just did a standard separation retirement and walked out the door, that is still going to be your effective date. So, when do I get my first paycheck? Well, again, let's just say you walk out the door, like I said, on your last day of employment was on May 4th. Okay, you will not get your first pension check in June. Why? Because that has already been set up to be sent to your drop account you already have, or there's a lapse in time for catch-up if you just do a standard retirement and walk out the door. So you will receive typically your first pension check, whether you were in the drop or a standard separation retirement, on July 1st is how it works. So yes, let's say you did your full 8 years in the drop. So actually what happens is you will get one additional drop deposit beyond that 8 years. Okay, you didn't do the drop at all. You didn't even sign up for the drop. You will still get your first pension check on July 1st, but it will be backdated and you will have a catch-up from when you retired, is how that works, since you didn't have a drop account to deposit the money in. So that's how that will work. There's going to be approximately the second month is when you'll start receiving your pay from the pension system. And typically, give or take the holidays or some shorter months, you will pretty much always get paid on or right around the first of a month. Okay, Now what? We got that figured out. You know when that works. You know when you get your first actual pension paychecks. The COLA. Big misconception on your COLA, your cost of living adjustment. How does that work? If you're below 55 or over 55, big difference. First of all, the requirements are to get cost of living adjustment, you must be 55. Those pension rules and laws all changed after some changes statewide with the pension in 2013. And you must be retired for 1 year. When you actually, from your effective date, like there again, my effective date was May 28th, but I retired on May 4th. So you have to wait till your effective date 1 year later to get your first COLA. If you're over 55, that's how that works. And then you will get it every year on your effective date. It is not a calendar year. It's a rolling year depending on what your pension effective date is. Okay, what happens if you're under 55? Okay, first of all, like I said, you got to do two things. You got to be 55 and you've got to have a full year retirement. That's a misconception. If you're over 55, you still got to be retired for 1 full year on your effective date. So if you're under 55, what's different? Well, here's what's different. You don't get any cost of living raise until your 55th birthday, and you still have to have 1 year of effective date retirement. Once you get that, you will get possibly a prorated amount for that month, whatever your birthday is of that month. For example, mine, I got a COLA for 1 week. Okay, how's that work with your effective date? Let's say your effective date is in this same year, but after your birthday, which was what mine is. No, you do not get a second COLA in that year. I will start getting your first COLA, like I did, the full month after you turn 55 going forward. You don't get another one just because your effective date is after your birthday. You have to keep that COLA till the next full year, till it comes around. So for me, it was going to be the next full year after my 55th birthday on my effective date of May 28th. And then going forward, that's how I get my COLA every year going forward after you're 55. So that's to clear that up. There again, I'm basing this all on current law and current Ohio police and fire pension rules that are different depending on what any you are in a pension system around the state. But this is current law as of spring of 2026. Now, there is a lot of federal legislation pending that we've talked about with President Trump and some other legislators in Washington that are trying to change those things. That's a whole nother video we'll have to update and change as those become effective, if and when they do. Okay, let's move on. Okay, we figured out the COLA. We know when you're getting your first paycheck. Like there again, you got to qualify for both, a year and be 55. So we got that. So, what is your COLA? Well, there's a big misconception about that as well. Your COLA, there again, this is all current rules and current law. But with the pension system right now, your COLA will be 3% of whatever your pension is set at when you walked out the door or retired. So whatever that is, you get 3% of that. But does it go up? No, it does not. You get the same amount every year. It does not compound. That is a big misconception. It's only 3% for the first COLA. So, for example, I've done the easy math here. Let's say you're lucky and you start off with a $100,000 a year pension. That breaks down to $3,000 a month of COLA because that's 3% of 100,000, okay? Easy math, which means your COLA monthly will be $250 a month for the first COLA. That is a true 3%. Okay, year 2, you've hit your effective date now. For the second year, you're 55, you're getting full COLA. So to clear this up, last year you got $3,000, which is what you're going to get every year currently. So now your pension's actually $103,000 a year. You will still now get your $3,000 a year COLA, which again is $250 a month. But since it does not compound, your actual effective raise is 2.9% for this year. Now, you see where I'm going with this. So year 3, you got your COLA again. Your pension is now $106,000 a year, and you still got your $250 a month pension, COLA. So in year 3, theoretically, your raise was 2.8%. So again, there's a big misconception that it's always compounding at 3%. That is not true. It's called simple compounding, or simple, not compounding, to clear that up. All right, moving on. There again, if there's anything you want to know, if any more videos you'd like me to make on this, just let me know. Reach out, hit like, subscribe my channel. We're going to do a lot of other things when I get this up and running and I get my studio built. I've got some more equipment coming. It's not going to be so lowbrow as you see right now. I just want to get this out there and get some information because I know it's spring, summer's coming, a lot of people are going to be retiring, burning time, whatever it is you guys do or girls do. We all done it. We all know how it works. I just want to get this information out there because I wished I'd have known a lot of this stuff, and so do other people that I get frequent phone calls or text messages from. Okay, going forward, let's talk about insurance. Insurance, well, it's a big animal. It depends on whether you are 65 and over or you're under 65. Big difference. And also, whether or not you're going to get a stipend. That beautiful grand stipend that's so great, which it is. We're very blessed to have that with our system. Many people don't have it. So, here's how this works. First of all, once you retire, the pension board, they will notify Alight, which is a partner with the pension system. You do not have to use them. They're just a partner with them. They just know the system pretty well. You can get a regular broker. You can do it yourself on healthcare.gov, etc. But the one thing you need to know is at any healthcare you get, if you want to get your stipend, it has got to be ACA qualifiable. Affordable Care Act qualifiable. There again, that's current law. There are talk of changing legislation. But it must be ACA qualified to be approved. There's been a lot of people I've read on our over 65 and under 65 Facebook chats and other websites that people have really got burnt over the last couple of years. We don't want to get into that whole TBL thing. A lot of people really got burnt bad on that. That's an ongoing mess. That's a whole nother video. So let's move on. Okay, you will get notified by Alight. You will have to send some paperwork you have to fill out for the pension board once you decide on your health care, whether you use Alight or if you use a broker or healthcare.gov, whatever. You pick your plan, make sure it is HSA qualified. And you can the pension system will sign off on that. Once you turn in your paperwork, you'll show them proof of your sign up and your purchase of the coverage. And they will, there again, they will vet it and approve it. And then they will notify to release your stipend money. They'll load that up into an account that you'll have to set up with Alight. That's a whole, we'll get into that too. How does that work? Okay. So, currently, if you're just a single person and you're under 65, your stipend's going to be right now $685 a month, which is $8,220 a year. If you just have the basic spouse, I believe it's $1,074 a month, which is $12,888 a year. Now, that's an account they're going to load up for you. If you retire partway through the year, which obviously most people do, most people don't retire around January 1st, you're going to get a prorated amount for that current year, and then going forward, it'll be a full amount as long as you don't have any changes in your status. So, there are a lot of disqualifiers with your stipend. There are a lot of misunderstandings as well. What is covered, what's not? Oh, by the way, TRICARE, if you do have the opportunity to have that military retirement, if you served your country and you qualify for that, kudos to you for serving. Greatly appreciated as well. It is ACA stipend eligible. Just give you a heads up on that when it does qualify. So, what are some disqualifiers? Okay, here we go. If you get a new job at all, part-time or full-time, it doesn't matter. If that employer, after you retire, even offers health care, you're not required to take it because nobody can make you buy that health care. You are required to notify the pension system that you have an employer that offers health care, and you have to sign a document, currently within 60 days, I believe it is, to turn in the pension system to forfeit your stipend. Yes, you do have to forfeit that stipend. So that's a decision you have to really consider, especially if you're going to work a part-time job. Okay. So, if you're married and your spouse has an opportunity for health care, yes, she is not stipend eligible for you. You cannot get the additional stipend for her. If you are getting it and she gets a part-time or full-time job, or there again, she doesn't have to take the health care at the new job, but you do have to notify the pension system and they have to remove her from the plan. She is not stipend eligible. Basically, it's always a way for the pension system to save money. There's no other way to put it. So, dependents. If you have a dependent, you can cover them up to the age of 26. But there are caveats for that too. Number one, from 18 to 26. First, your dependent must be natural child of yours, of the retiree, or it must be legally adopted child. It is very clear, stepchildren do not count. Stepchildren are not stipend eligible. So that's a decision you'll have to make on that regarding their health care. You can get health care on your own for them, but they are not stipend eligible, so you will not get the additional money. Again, these are all current law and current information from the pension system that you can get yourself and download. I'm just trying to save you from making a bunch of phone calls, because you do sign a paper with the pension anytime you change or sign up for your stipend, verifying the information is currently correct. You have boxes you got to check, so they hold you legally responsible for basically attesting to that information on that stipend eligible forms, which I understand. Okay. If you're retired and your spouse is retired as well, let's just say you have somebody that from another pension system that is both of you retired, but her pension as well, or his, whichever spouse it is, male or female, if their pension offers any kind of health care plan, they are not stipend eligible through the Ohio Police and Fire pension. You do not get the extra stipend for them because they have the availability of health care through their own pension, just like another job. So no, I have spoken to our pension reps. I've read the data myself. That is currently the rules. So that's a misunderstanding as well. So again, if they have health care, or let's say their pension doesn't offer health care this year, but next year they come up with a plan and they do offer health care to that whatever retired entity it is, teaching, welding, whatever union or whatever the pension system might be. If they do currently whenever they create a option for health care for the other retiree spouse, they are no longer eligible for Ohio Police and Fire stipend portion for them. So again, you have to notify them to remove them. Like it or not, that's how it currently is. Another big misconception. So there again, you got to really consider, if you go back and get a part-time job or a full-time job, or your spouse does, is it really outweigh giving up your stipend? Again, we touched on the dependents. Your dependent up to the age of 26 can be married, and you can still get the stipend addition for your legal dependent. Again, natural born dependent or legally adopted dependent. Again, stepchildren do not count. They're not stipend eligible. It's just the way it is. So, there again, you got to make that decision. But at 26, that's the time limit on that. Now, if those 18 to 26-year-old has a job and they have the option for health care at that job, they are not stipend eligible. You got to notify the pension system. They don't have to take the health care offered at whatever job they have, but if it is available, you attested to that fact. So it would be, I guess, falsifying your stipend form. So you, again, would have to notify the pension that your dependent under the age of 26, 18 to 26, is no longer stipend eligible. You have to forfeit that amount for them because they have the option for health care, whether they take it or not. Okay, 65. I'm not there yet, but I did get some information on that today that I did not know. Like I said earlier, under 65, you can use a light, you can use healthcare.gov, you can use a broker. There are no differences in the price of the plans. They're pretty much all the same plans. However they get paid, it doesn't affect the cost. I looked at a light many times. I wound up using a broker because it's more personal to me. She helps me out. So the price is the same. So it's all figured in. Like I said, a light is basically a partner, is the way I would put it, with the Ohio Police and Fire currently. Now that could change. It's up to you. Okay, moving on. 65. Learn this new one. You do have to, when you go on to Medicare at 65, A and B, you must use a light to keep your stipend for over 65. It is not optional. So apparently, from what I read, once you're getting close to age 65, a light should reach out to you and notify you of this system. And again, to keep your reduced stipend once you hit 65, because it does go down, you do have to use a light. There again, that's current. Who knows what laws or legislation changes? This is as of spring of 26. Remember, this is all based on facts and data that I've researched and spoken to myself. So again, if I misquote anything, if there's any misunderstanding, I apologize. This is my current knowledge. I don't want to, give any misconception out there. Okay. So, stipend currently for 65 and over. Retiree only currently is $143 a month for Medicare A, $107 a month for Medicare B, for a total of $250 a month for the retiree only once you're 65. If you have a spouse and you're both over 65, and she does not or he does not have additional opportunity for health care, you're both on 65 Medicare now. Again, you have to use a light. The stipend then becomes $239 a month for Medicare A, $107 still for Medicare B, for a total of $346 a month for a retiree plus spouse for their over 65 stipend for their Medicare A and B. Okay, there is a caveat here, which if you're lucky, you don't qualify for this. But I'm sure there are some people that may, depending on if you're in a small department or if you just weren't as fortunate enough as some of us were to work in some big departments, that, there again, we were very blessed. If for retiree only, if your family income for the year is currently $39,125 or less, you can apply for an additional 30% bump in your stipend. There again, you have to apply for this. It's not automatic. So if you do, and you qualify for that as a retiree only, your new stipend for Medicare A will be $185.90 plus $107 for B, for a monthly stipend of $292.90 for Medicare A and B. If you have a spouse and you're both over 65, your total family income is less than currently $52,875, you can qualify again for the 30% bump, but you have to apply for this. You have to go get it. So if you do that, your new stipend adjusted will be $310.70 a month for Medicare A, $107 a month for Medicare B, that doesn't change, for a total of $417.70 a month for you and your spouse who are over 65 for your Medicare A and B stipend. So there is a nice little help there if you're less fortunate than some people are, and they're for a low income stipend is really what it is. Which is greatly appreciated to those people. They put a lot of time and service into their job as well. Okay, the drop. The grand old drop. So, obviously, currently, it's still 8-year max from whatever your effective date is. Like I said, mine was May 28th, so with that, you're capped at that date. Don't dare go over that day. If you go over that date, you forfeit all of your drop. You automatically revert back to a standard retirement, which I'm sure everybody knows that when you sign up. So, you sign up for the drop, you're legally in the drop, you are legally retired. So even in the drop, you can still get your 4-unit sticker put on your car and go to the meetings. Okay, you walked away from your drop at any time. You don't have to. Remember, you got to do the 5-year minimum to keep your interest accrued in your drop. After 5 years, you're released from that. You can walk away at any time. So how does that work? Well, here's how it works. You still keep the principal in that drop account, whatever you contributed personally. So you can still bust your butt, work overtime. You can walk away whenever you want. You still keep all the principal. The interest is removed. They just zero out the interest. It's just gone. So You still are locked into that 5-year effective date, though, of whatever it is to unlock that money. So, at 5 years, you can take the money like a regular drop after 5 years, or you can just leave it there. If you leave it there, it will just start accruing interest again, which now you keep because you've locked in your 5-year date. You've already burnt through that lockdown period. So going forward, you'll collect the interest based on the current, I believe, the 10-year Treasury bill. And how that works is that usually changes, I think, every day or so in the real world market. But from my understanding is the way it works is whatever the beginning of each quarter of the year, whatever the current T-bill rate is, I believe the pension board locks it in for that entire quarter. So sometimes it goes up, sometimes it goes down. Sometimes you get kind of hosed on that. Sometimes you really benefit because it went down, you got locked into higher rate. Either way, that's how I believe it currently works. So basically what it is just a high yield savings account. It's really what it is, but it has a 5-year lockdown. So again, if you walk away after 1 month of drop or 4 years and 11 and a half months in the drop, whatever, they remove your interest, you keep your principal, but at 5 years on, they start giving you money, or you can take that money, move it. I believe you can roll that into your deferred comp, or you can start withdrawing money or set up payments for that. It's yours. So that's how that works. It just restarts calculating interest, which is currently right around 4%, so it's a good deal. There again, that's just simply really a high yield savings account at that point. Do with it what you want. You just have to claim it as income whenever you take out. Just remember that. Couple more things. Okay. For those who do have a HSA, healthcare savings account, not everybody does it. We were just offered this a handful of years ago. A lot of people don't understand it. It's a big misconceptions with that as well. But it is an absolute gold mine. If you start off young, contribute every dime you can up to whatever the current year federal limit is, because it adjusts every year with the limit you can contribute to one. You put it in tax-free, you use it tax-free, so basically you're taking it out tax-free. It's like triple tax-free. Absolute gold mine if you're young and if you're healthy. And it accrues interest, and the interest is non-taxable. You don't even have to claim that on your income tax every year. So, once you retire, walk out the door, by law, current law, you can no longer contribute to a healthcare savings account. You may try, your banking entity will probably take the money, but it's on you to know the law. And no, you cannot contribute after you have retired unless you have earned wages somewhere else. Your pension is not technically earned wages. It's basically because it's not a W-2. So if you go back or get a W-2, or if you already have another job that you work in already when you retire that earns a W-2, you can legally still continue contributing to an HSA, which is, again, it's a great deal. It's awesome. Where else can you use money tax-free sheltered and use it tax-free and basically take out tax-free? I mean, take advantage of any tax loops you can. And trust me, when you're retired or getting there, you'll look for every tax loop there is because you got nothing to hide once you're retired for the most part. One of the biggest problems a retiree has is no tax advantages anymore. That's when you got to create something for yourself. Okay. What can you do with the HSA account? Number one, you can pretty much use it for, if you have one, you can use it for pretty much any qualified medical expenses. If you just research, is this item, whatever it is, HSA eligible? Google, ChatGPT, whatever you use, AI will pretty much tell you instantly yes or no. Okay, it's pretty simple. A lot of things are HSA eligible. Trust me, things you wouldn't even think of. Great financial benefit. One thing that's a catch-all that people don't realize is current law, again, you cannot not pay medical premiums with an HSA account. I don't know why. It makes no sense, but you can't. But you can pay for optical or dental premiums, just not medical premiums. That's just current law. You can research it yourself. You'll see what it is. That's just the way it is. You might get away with it, but they do reconcile because the pension board obviously files documents with the IRS, so the government knows that you're getting a stipend, and obviously your banking entity that holds your HSA account is doing the same thing. And they do send you documents each year for tax season telling you what money you used out of your HSA and also how much you contributed. So the government they're overwatching you. They're reconciling those records. So I would not advise trying it. Could come back to bite you with some big penalties later. And Uncle Sam loves extra money from you. Don't give it to him. You pay enough in taxes. Again, myself, I use it for my optical and dental premiums. That's up to you. But I just currently dropped optical and dental. I did all the math. It does not math. Absolutely devastating. I'll tell you why. I'll give you a quick note before I move on. I paid 3 months this year in my dental premiums. Currently, mine are about $28 a month for dental. I won't talk about who it is. But, so I went to my dentist, found out with my current plan, there's a 6-month window that you don't have any coverage other than just basic cleanings. After that 6 month, you start to get some coverage. After 12 months, you get the full major coverage. So there's minor dental coverage with my plan, major dental. Here's the caveat. This is hilarious and it's pretty pathetic. When you buy any kind of health care on Obamacare / healthcare.gov, whatever, every year that plan is dead and gone even if you keep the exact same plan. It does not carry on. So what does that mean? Well, basically, January 1st, I kept the same dental. So basically, for minor coverage, I have no minor coverage until at least July 1st. Now, here's the real pickle. When do you get major coverage? Well, you never do, because at 12 months, major coverage kicks in. So until God or the government decides to add more months to the year, you will never reach major coverage with the dental plan that I currently have. So those are caveats that I found out personally. So I just had some dental work done, minor, cavity filling, typical, had no coverage. I'm like, what do you mean have no coverage? They said, yeah, you haven't reached your 6 month, so no coverage. So in a nutshell, I went in, got it taken care of, $300 out of my pocket. Okay, it is what it is. So I asked them, I said, let me ask you this, my dental office. If I would have paid 12 months of premiums all year and my out-of-pocket money for just my 2 basic cleans a year, no fillings, nothing else, how much would it have been? Here's where you get a little upset. It would have cost me for 12 months premiums and my out-of-pocket for 2 basic cleanings, approximately $280. And I said, how much would those be if I just walk in and pay with no health care? $240. They're about $120 a piece. So basically, this year, I would be paying about $300 for $240 worth of cleanings. Math out that math. So there are some nuances I found out the hard way. So therefore, into this month, no more optical, no more dental. Same thing. My personal eye doctor, I ask about that. How much do I get if I have no optical? Oh, we give people with no optical insurance, we give them 25% off. So there again, I went for my annual checkup. I asked them, what would this have been without optical? It was almost a wash. So there's really no benefit, at least with my current plan, to have vision either, and I wear contacts and glasses, gone too. All right, everybody, thank you for tuning in today. Hopefully this video was helpful. Hopefully it will give you some knowledge and make some transition into retirement a little bit easier for you. Also, make sure you like and subscribe to the channel. Pass this information on to other retirees. Hopefully it will help them as well, or future retirees, because there again, there's so much we think we know about it. And I hope this makes the transition into not only the retirement, the pension, and also health care a little bit easier for some people. There's so much of these things I wished I would have known, and so many myths out there that are just not true, whether it's with the pension system or whether they're just IRS laws and regulations. Again, like and subscribe. Tell your friends about the channel. Richard White Global. You can also email me at richhistory71@gmail.com. That's RICHHISTORY71@gmail.com. We're going to get back to making the regular videos this channel is intended for, which is going to be basically about history, travel, and also politics. We're going to talk about history the way we think we know it versus how we got there. We're going to run it back and get back to the facts that create the history that we all live in. And it also will give us some insight of where we're going with history, because it always repeats itself. And also, we're going to talk about politics. And we're going to talk about travel when I go abroad. I'm really looking forward to doing a lot more traveling. I've been very blessed to do a lot as it is around the world. Going to do a lot more about that. We're going to get into the history when I go abroad, which I'm looking forward to a big Asian trip this summer, so stay tuned on that one. Again, like and subscribe. Leave your comments. Can't wait to hear from you. Hopefully, my brothers and sisters out there again in the Ohio retirement system are enjoying it. It's worth it. It's well worth it. Go enjoy the sunshine, the beach, see the world. It was all worth all the overtime you worked. So it's better than they say it is. Trust me. Until later, this is Richard White Global. I'm your host, Richard White. Thank you for tuning in.